So as you can see in this slide, biofilm is made up of a bunch of different bacteria, fungi, and protozoa. Now, the only bacteria that we really need to test for is Legionella, since it has such a deadly cause in the patient. So, back to our example at the baseball game, we find out that the number of people in the baseball stadium, but we want to make sure that if there's an actual threat, we know what it is. And Legionella is that threat. So we identify Legionella by itself. We have to do a specific test for it. Now, Legionella was discovered in 1976 after an outbreak of pneumonia. It was found out that in a hotel in Philadelphia that there was condensation. Legionella was blowing into the air ducts and people were breathing it in. It caused 29 people to die and 182 cases ended up in the hospital. So we found that alone in a dental office, especially because as the water is hitting the patient's mouth, we're now causing bacteria to be aerosoled. And the patient, the doctor, and the staff are breathing that in. And if there's Legionella present, we can have huge impact on our patient's health, especially if they're immunocompromised. Now, you can see in this slide the different places that we find Legionella. Really anywhere that has water in a moving fashion. We can breathe in that aerosol bacteria. As a kid, I know I would go to the different water parks and those little misters that you would walk through to cool you down is a huge place that we found that Legionella can be present. We're breathing in those aerosol bacteria and it's headed straight to our lungs. So that is the only bacteria that we have found that needs to be tested by itself. So a normal test that we do in an office, we're finding colony-forming units, CFUs. But specifically testing for Legionella is a must in the office.